Hello there, welcome to my channel. Monchero Kemwa here. Today we are talking about a special topic known as Walant. That is wide awake local anesthesia, no tonic. I know it's a mouthful, but in simple terms it means numbing the area that is being operated on without tying it. This is a procedure that is usually carried out by surgeons. It can be done as a daycare or a day surgery case, or it can even be done inside the operating room. What procedures are these that Walant can be used in? Walant can be used in procedures like forearm surgery, wrist surgery, and hand surgery that has been severed. Can also be used to repair the tendons. It can also be used to repair the skin, like if it's skin graft that is being done. Another procedure that it can be used on is carpal tunnel release. So like if you're having a problem to the hand, what you call carpal tunnel, Walant can easily be used to correct the problem. What are the benefits of Walant? Walant can be used in resource-challenged institutions. For example, like in sub-Saharan Africa, where we do not have adequate equipment and even enough staff to be able to perform general anesthetic surgeries, this Walant comes in handy to be able to solve the patient's problem. So if you're having a problem and you need to go to the hospital and get operated on, if it is in your hand, be sure to find out from the surgeon whether this technique can be used on you. The other benefit of Walant is that, as we said, there is no tourniquet that is used. Tourniquet sometimes has had adverse effects on patients. How does this adverse effect come in? Because the tourniquet, when it's tied, it can stay for long, and maybe the surgeon and the team are concentrating on solving the problem. Maybe it was tendon repair or nerve repair, and it can take long. Sometimes the team may forget that it is 1 hour or 1.5 hours, and if it's left there in place for long, the tourniquet can cause ischemia, which ends up causing gangrene, and even in other situations it has even led to amputation. Now what happens is the surgeon usually cleans the area that is going to be operated on using an antiseptic. This is usually after you have given consent and all the workups have been done, and this can be done at a daycare place or even in an operating room. So the surgeon, after cleaning with an antiseptic, injects a local anesthetic that only numbs the area that is being operated on. To numb the area, it means that the nerves are not able to take back the message from the area that is being operated on to the brain for you to sense pain, meaning that you can even have a good talk with your surgeon and the team that are operating. How nice is that? So Walant is a good procedure. If you have a condition that may require to be operated using it, be sure to find out from your surgeon. Yeah, if you're new here, subscribe, share with your friends, and comment in the comment section below. See you again in the next one.